Hi, I'm Dr. Angel Bice from Charleston Animal Society, and I'm going to give a presentation over retroviruses, particularly FeLV and FIV. So just to start with, I did kind of color code this. Anything that's in green means that it's specific to retroviruses, both FeLV and FIV. I put the things in purple that are specifically only for FeLV, and things in blue that are for FIV. So hopefully you can follow along because I know that these can get confusing. Sorry there's not a lot of pretty pictures. FeLV and FIV are kind of boring, but something that we deal with on a regular basis, so information that we need to know. So what is a retrovirus? It's any group of RNA viruses, and they insert a copy of their DNA into the cell, which is really smart, and it allows that cell to go ahead and start replicating and reproduce the virus. So unlike many other viruses that enter a specific cell in the body and destroy them, the retroviruses enter the cell in the cat's body and then change the cell's genetic characters. And this permits the virus to continue reproducing within the cat each time the cell divides. So this allows the virus to become dormant, sometimes inactive, in some cats, and making the disease transmission and prognosis much more difficult for us to predict. So FeLV, which we're going to see in purple throughout the presentation, it stands for feline leukemia virus. And so as the name implies, it's a viral infection of cats that affects the cat's immune system and the bone marrow. So FIV stands for feline immunodeficiency virus, and although it's not contagious to people, it does have some similarities to the human immunodeficiency, HIV. So how do cats get FeLV? It's generally transmitted through direct contact, specifically the saliva from an infected cat. And you'll see social behaviors such as mutual grooming, sharing a food or water bowl. These are the things that can spread it. And kittens can become infected during fetal development or through nursing from mothers. So this is one that we definitely want to test for if we're going to be if we have a mother that just finished nursing and we have maybe some feral kittens or some kittens that came through that were neonates and need a mother, we want to test that mom because she can spread the virus to those kittens before we add kittens to her. So that is definitely something to keep in mind. And remember that this is direct contact. So if a cat is FeLV positive and it's hanging out in a room or environment, and then that cat leaves and another cat comes in, it's very unlikely that it will catch that disease. They have to be in direct contact, lick, groom each other, or share the same food or water dish. So FIV cats, how do they get FIV? It's also transmitted through contact with saliva from an infected cat, but it's very different if the contact has to be through bite wounds sustained during usually fights with infected cats rather than social behaviors. So it's not easily transmitted. Two cats that groom each other would be very, very, very rare for them to catch it. So it's totally different from the type of saliva contact that's needed for FeLV. So FeLV and FIV are both killed by common disinfectants. Thank goodness. So pretty much most of your household cleaners, Lysol, any of those, not that we use those in the shelters, but anything that's very simple like that would kill these viruses. They don't live long in the environment, so they're going to die very easily anyways. So contact with an infected cat is generally necessary for the disease transmission. So what are we testing for and at what age? So FeLV blood ELISA test for the antigen. The antigen means it's a direct test for the presence of that virus in that animal. So testing positive just means that the virus is circulating in the cat's bloodstream. It does not mean that the cat will be permanently infected. It is possible for them to fight off the infection, but then we have to wonder, did it just go dormant? Similarly, some cats may be FeLV negative at one point and then test positive later as the virus progresses through various stages and becomes more prominent in the body. So was it dormant and then now it's not? Or has it now formed enough virus for us to be able to catch it on the test? These are all very confusing questions we have to deal with sometimes. So what are we testing for in the age? With FeLV, we're testing for the antigen like we discussed, which is direct. And we can test kittens at any age. Here at Charleston Animal Society, we test them when they are 0.6 pounds is when we start testing. So if you do get a positive, there is a confirmatory test available. We personally do not use this test, but we do give a handout to adopters to let them know that they can follow up with a regular veterinarian and that this is a confirmatory test that is available. So the IFA is a confirmatory test. So how about for FIV? So with FIV, we're testing for the antibody. So the antibody is what the body makes to fight the virus off, which shows us that there's been some exposure to the virus if the body made that. So we're not testing for the virus directly. So kittens may test positive after having received antibodies from the mothers. So either this is in utero or by the milk, they can get the antibodies. And it can take up to 6 months for these antibodies to go away. So we can get false positive tests from kittens when we test for FIV. So they do get the antibodies through the milk and through utero, but they do not catch the actual virus in the milk or in utero. So an FIV positive cat could be a surrogate mother for negative kittens, but it's going to give them a false test. So we want to be aware of that and try to avoid that situation. So adults, and then we want to keep in mind too that 6-month period that it takes for those antibodies to completely go away. So adult cats that have been vaccinated for FIV will also test positive for the virus since their body has reacted to that vaccine and made the antibody even if they were negative. So you always want to microchip a cat if it's going to be vaccinated for FIV. That way that information is linked to the microchip that it's been, and put that in the notes that it's been vaccinated for FIV, not that it was originally positive. So there are some new tests available that can differentiate between the vaccine and the infection antibodies. That's not as common of a test. It's a special test you have to send off for. So since we talked about that 6-month period for the antibodies to wean off from the mothers, that's how we decide on when to test our kittens for FIV. So we test all kittens for FeLV, and then once they're 6 months of age or older, we do the combo test for both the FeLV and the FIV. There's also the Western blot, and that is the confirmatory test for the FIV. Again, not one that we use on a regular basis, but we provide that information for adopters. So a summary of the testing. So you can blood test at any age for FeLV, and then you want to wait to 6 months or older for FIV. If you got a positive younger than 6 months, then it's probably going to be a false positive, but we won't know that for sure until after they're 6 months old. So there's a lot of information here, and it's all very confusing. We don't expect you to be able to train your staff on everything other than give them the protocols on when to test for what, and then have handouts available on FeLV and FIV to be able to give adopters. So you can't remember all this stuff. We personally adopt out FeLV and FIV positive kittens. So recommend follow-up with a confirmatory test with their regular veterinarian. And even if it's a negative test, we recommend that they repeat the test in 6 months with their veterinarian so that they know for sure, and they have it on file there as well. So this is a test comparison that was done, and it showed that the IDEX SNAP test was very superior compared to the other tests for picking up and being accurate for FeLV and FIV testing. We do use the SNAP test based on this information. The other tests are pretty decent, so you could use those, but just to know that the best one out there currently studied is the IDEX SNAP test. So can FeLV positive cats live in the same house as FeLV negative cats? So it's not recommended because of the direct contact that FeLV can give to other cats in the house. So we do not recommend that FeLV positive cats be housed. Kittens are more susceptible at contracting FeLV than adult cats as well, so something to keep in mind. But FIV positive cats have been found that they do well living with FIV negative cats. There have been studies. So you want to make sure that the cat is not one that frequently gets into fights, as we know that it's transmitted through those deep bite wounds. So yes, as long as the cat gets along and they do not fight, there's a Purdue University College of Veterinary Medicine study that showed that the cats, they drew two conclusions from the study. One, FIV negative cats can live with FIV positive cats can live with FIV negative cats and not get infected during normal day-to-day interactions. Mother cats infected with FIV don't pass the virus on to their kittens. So this is very useful information. So do FeLV positive cats have normal lifespans? It's been found that FeLV positive cats can live a perfectly happy life, and they deserve to do so, but people who have FeLV positive cats do need to be aware that they may have a shorter lifespan. So the median survival for cats with FeLV is diagnosis is 2.5 years. That is a significant difference in lifespan, and I think it's important that adopters are aware of what they're getting into with that. So FIV positive cats have been found that they do have normal life, normal lifespans, both quality and duration. They do take special care in terms of monitoring for any signs of infection, and they have a tendency to have bad dental disease in the future, so you want to warn them of the things to keep an eye for and what to look for, especially with the dental disease as well, because that can be costly. So clinical signs and treatment. Most FeLV and FIV positive cats present as healthy and normal cats. Usually we only catch this on their testing. The symptoms can include lethargy, poor appetite, weight loss, vomiting, diarrhea, oral inflammation, pale mucous membranes, neurologic disorders, and chronic eye problems. But there's no treatment, there's only supportive care. So vaccines, you may have heard things about the FeLV and FIV vaccines. So FeLV vaccines are expensive, and that's one of the reasons that you don't see them given in most shelters. They are recommended for kittens, all kittens to be vaccinated and receive a booster after their first annual checkup. And it's a very effective vaccine, so it's a good thing to do. Continue to vaccinate cats that are at high risk for the disease, ones that are indoor-outdoor cats or live primarily outdoors, or if they have an FeLV positive housemate. Now the FIV is a much more questionable value because it doesn't protect against all of the strains or even most of them, so only a few of the strains. And they make the cats appear like they're FIV positive on test. So like we talked about earlier, if you're going to vaccinate for FIV, you really need a microchip and definitely connect that information with the microchip. This is all the information that we currently have. If you have any questions, feel free to contact me. My email is abice, that's A-B-I-C-E, @ charlestonanimalsociety.org.